Vienna, the Vienna General Hospital, 1847. You wash your hands. Stay with me, because 47 years from now, the name they forgot to write down will be the only name that matters, and it will cost you everything. You are Ignaz Semmelweis. You are 29 years old. You are the new assistant director of the first obstetrical clinic at the largest hospital in the world. And you are watching women die. Not slowly, not rarely, not from old age or mysterious illness. They are dying at a rate that makes your hands shake when you write the numbers down. 1 in 10, sometimes 1 in 6. Young women, healthy women, women who walked into this hospital to give birth to a child and are leaving in a coffin. The disease has a name: childbed fever, puerperal fever. It has existed as long as hospitals have existed, and the medical establishment of 1847 has made its peace with it. It is considered an acceptable loss, a mystery of nature, an act of God. You do not accept it. The hospital around you is the most advanced in the world. 1,200 beds, doctors arriving from across Europe to study the latest techniques of a profession that believes it is on the edge of a great scientific age. Everyone here is certain they are doing the right thing. It has 2 obstetrical clinics, side by side, serving the same city, delivering the same babies from the same population of women. In the second clinic, staffed by midwives, the mortality rate from childbed fever is approximately 2%. In the first clinic, your clinic, staffed by doctors and medical students, the mortality rate is 10%, sometimes 15%. In the worst months, higher. The women of Vienna know this. They beg to be admitted to the second clinic. They give birth in the streets rather than enter the first clinic. There are documented cases of women kneeling in front of hospital administrators, weeping, pleading not to be sent to the doctors. They are sent anyway. You watch this. You stand in the admission hall and you watch terrified women being directed through your doors. And you understand, in a way that cuts through all the professional language, all the institutional comfort, all the careful medical detachment you have been trained to maintain, that something in your clinic is killing them. You do not know what it is yet, but you know it is there. You will not leave these walls easily. You will not see your family for days at a time. The clothes you arrived in, pressed and clean, become stained within hours of your first ward round. You learn not to think about what the stains are from. Outside these walls, the world is burning. The Taiping Rebellion has begun. Revolutions are building across Europe. Foreign powers press their demands at every coast. Inside these walls, you are not supposed to know any of this. But your father taught you to read. He taught you to ask questions that other people had stopped asking. And that changes everything.
Your predecessor noticed the difference in mortality rates and concluded that the first clinic's higher death toll was caused by the shame women felt at being examined by male doctors. The psychological distress, he argued, weakened their constitution. This explanation satisfied the hospital administration. It satisfied the medical journals. It satisfied everyone who did not have to watch the women die. It does not satisfy you. You begin keeping records, meticulous, obsessive records. Every death, every case, every variable you can measure. You are looking for the pattern that everyone else has decided does not exist. You change the patient's position during delivery. No change. You improve ventilation in the ward. No change. You alter the schedule of examinations. No change. The women keep dying. Then, in the spring of 1847, your colleague Jakub Kolečka dies. He is not a patient. He is a professor of forensic medicine.
He dies after being accidentally cut by a student's scalpel during an autopsy. His symptoms, the fever, the inflammation, the systemic collapse, are identical in every detail to the symptoms of childbed fever. You sit with this fact for a long time. Kolečka died from a scalpel contaminated with material from a corpse. His symptoms were identical to childbed fever. And your clinic is staffed by doctors who spend their mornings performing autopsies on cadavers and their afternoons delivering babies. The second clinic is staffed by midwives who do not perform autopsies. The connection assembles itself in your mind with the terrible clarity of something that was always obvious and somehow never seen. You are carrying something from the dead into the living. On your hands, on your instruments, on the hands of every doctor and student who moves from the autopsy room to the delivery ward without washing. You are killing them. Not intentionally, not maliciously.
In complete ignorance, following the standard practices of your profession, you and your colleagues are transferring material from corpses directly into the bloodstreams of women giving birth. The realization does not feel like triumph. It feels like standing in a room where you suddenly understand that you have been the cause of everything you have been trying to prevent. You implement a solution immediately, before you have published anything, before you have presented your findings to anyone. You place a basin of chlorinated lime solution at the entrance to the first clinic. You require every doctor and student to wash their hands in it before examining any patient. Not a rinse, a thorough wash, until the smell of the autopsy room is gone from their hands. The results are not gradual. They are not ambiguous. In April 1847, 18%. In June, the first full month of mandatory hand washing, 2%. In July, 1%.
In 2 months, you have reduced mortality in your clinic from 18% to 1%. You have saved the lives of dozens of women in a single summer in a single hospital. You write up your findings. You stand in the lecture hall and explain, with your data laid out in front of them, exactly what is happening and exactly what stops it. They do not believe you. They do not believe you, and their disbelief is not passive. The men who run the Vienna General Hospital are not stupid. They are not lazy. They are not indifferent to their patients. They are, by the standards of their era, serious and dedicated physicians who have spent their careers building the most advanced medical institution in the world. And you are telling them that they are the problem, not the disease, not the patients, not the air or the season or the shame of being examined by a male doctor. Them, their hands, their instruments, their morning autopsies followed by their afternoon ward rounds. Their standard, accepted, universally practiced procedures. You are telling them that everything they have been doing is killing people. This is not a message that a profession receives with gratitude. The objections come immediately. The germ theory of disease does not yet exist. Louis Pasteur has not yet published. Joseph Lister has not yet transformed surgery. The scientific framework that would make your discovery obvious simply does not exist in 1847. You cannot point to a microorganism under a microscope. You cannot explain the mechanism. You can only point to your numbers. And your colleagues point to other numbers. Childbed fever exists in homes, they say. It exists in hospitals with no autopsy rooms. Your theory does not explain all cases, therefore it cannot be correct. Your sample size is too small. Your methodology is flawed. They are not entirely wrong about the gaps in your evidence. You know this.
The science of 1847 does not give you the tools to prove what you know is true, but you have 18% falling to 1%. You have women alive in July who would have been dead in April. That should be enough. It is not enough. The most painful opposition does not come from strangers. It comes from Johann Klein, the professor who controls your position at the hospital. Klein is the man whose clinic has been killing women for years. He is also the man who decides whether you keep your job. He does not engage with your data. He does not request a formal investigation. He simply makes clear, through the institutional channels available to him, that your presence in the first clinic is becoming inconvenient. In 1849, your contract is not renewed. You leave Vienna. You are 31 years old. You have just proven one of the most important medical discoveries in history. You are unemployed. Budapest receives you with somewhat more warmth. You are appointed to the obstetrical ward of St. Rochus Hospital. It is not the Vienna General Hospital. It is not the prestigious posting you had. But it has a delivery ward, and it has women dying of childbed fever at the same rates you saw in Vienna. You implement the same protocol: chlorinated lime, mandatory hand washing, the same insistence, the same data, the same meticulous records. The results are the same. Mortality collapses. Women who would have died do not die. In 1861, 14 years after your discovery, you finally publish your findings in full. A book, 436 pages. Every case, every number, every argument you have spent 14 years accumulating. The title is precise: The Etiology, Concept, and Prophylaxis of Childbed Fever. The medical establishment of Europe receives it with comprehensive indifference. Rudolf Virchow, the most influential pathologist in Europe, dismisses your work. In Britain, in France, in Germany, in Austria, the response is the same: polite dismissal, occasional mockery, a near total failure to implement protocols backed by 15 years of consistent evidence from 2 countries. You begin to understand that the resistance is not scientific. It is not about evidence. It is about what acceptance of your evidence would require. If you are right, if unwashed hands are killing patients, then every doctor who has ever moved from an autopsy to a delivery without washing is responsible for deaths. Not legally, not criminally, but morally, the weight of it is immense. The men who dismissed you have been practicing medicine for decades. To accept your findings is to accept that their entire careers included a practice that killed the patients they were sworn to protect. Human beings, including brilliant ones, are not constructed to accept this easily. The years pass. You keep writing. The tone of what you write changes. In the early letters, you are careful, precise, professional. You present data. You anticipate objections. You respond to criticism methodically. By the late 1850s, something has shifted. The letters become longer, more urgent, more personal. You begin writing open letters to the leading obstetricians of Europe, not appeals, but accusations. You call them murderers. You use that word directly, in print. Your colleagues in Budapest begin to worry about you. Your wife worries about you. You are not sleeping well. You are repeating yourself in conversation. You are talking about childbed fever at dinner parties, at social gatherings, in contexts where no one has asked and everyone wishes you would stop. You cannot stop, because the women are still dying. Every day that passes without acceptance of your protocol, women are dying in hospitals across Europe from something you know how to prevent. You have known how to prevent it for 15 years, and no one is listening. The grief of that, the specific, accumulating grief of knowing the answer and being unable to make anyone use it, is doing something to you that no professional setback could have done on its own. In the summer of 1865, your colleagues act. Your friend Ferdinand von Hebra arranges for you to visit a facility outside Vienna. He tells you it is a health retreat, somewhere to recover your nerves. You go with him. You realize what it is almost immediately. On August 13, 1865, you are admitted to the Dobling Mental Asylum outside Vienna. You are 47 years old. You have not seen your wife or your children since the morning you left with Ferdinand. The Dobling Mental Asylum is not a rest facility. You understand this within hours of arrival. The doors lock from the outside. Your personal belongings are taken. The other patients around you are men in states of severe psychological collapse. Men who do not recognize where they are. Men who cannot complete a sentence.
You are not like them. You know exactly where you are. You know exactly what has happened. You try to leave, you are prevented. You try to explain yourself to the staff, who you are, what you have discovered, why your presence here is a mistake. They listen with the practiced patience of people who hear explanations like this regularly. Within days of your admission, you sustain injuries. An infection develops. It spreads. It is, the doctors later determine, the same class of infection as childbed fever, the same mechanism. Bacteria entering through broken skin, spreading through the bloodstream, causing the same systemic collapse you spent 18 years trying to prevent in others. You die on August 13, 1865, 14 days after your admission. You are 47 years old. The cause of death recorded in the asylum's documents is pyemia, blood poisoning. The same disease you discovered, the same disease you proved how to prevent. The disease that killed you in an institution where no one washed their hands. The medical establishment of Europe does not immediately notice that you are gone. There is no obituary in the major journals, no memorial lecture at the Vienna General Hospital, no formal acknowledgement from the institutions that dismissed your work. You were buried in Vienna with a small service attended by a small number of people. The women keep dying in it.